If someone were to come in and say, I have these frequent episodes, the most valuable thing that we can do is to get a blood test or a urine test immediately after you've had one of these episodes, right? If you have chronic symptoms every day that aren't episodes, the result is not going to be as helpful. Whether it's abnormal or normal, the result will not be as helpful. The most important thing that we could do is to either get a tryptase drawn within 4 hours of the episode happening, or to start collecting urine within hours of the episode starting, to be sent for, in the case of the blood, to be sent for a tryptase is the test. In the case of urine, there are 3 different metabolites, meaning that your body has processed what the mast cells would release. Those tend to hang around in the body longer, and you can see them in the urine. For years and years, the most commonly done thing is the blood thing, because you can order it and there's a test. The urine tests have not been available as long and haven't been used as long, although in some ways they might be better, because as long as you have a cup and you can aim, you actually can get that test done, and you don't have to beg someone else to draw your blood, which is what we have to do all the time. We beg docs to draw the blood, but in the end, the urine testing is actually quite sensitive and specific. If they were elevated after one of these episodes, then we would want to look at what they look like at baseline, because there are special cases where, and actually more common cases, where your tryptase is always elevated. That's hereditary alpha tryptosemia. So if your tryptase were elevated after you had one of these episodes, and then your tryptase were still elevated at baseline, not much different than what it was when you had the episode, may have nothing to do with the mast cell at all. It's just you happen to be one of the many, many millions of people who have a hereditary alpha tryptosemia. The urines is probably a little bit different. We don't know yet that it's common for someone to have one of these abnormal mast cell mediator metabolites in their urine. And so if those were elevated at baseline as well, we probably would be concerned that there's a mast cell disorder happening. But comparing the baseline to when you have one of these episodes is the most important thing that we can do, as opposed to just taking the value and saying, oh, this is the diagnosis, because it's usually not.
So do patients, if this happens, how fast do they have to get to their doctor to give them like a fresh sample of urine? Can it be 12 hours later, or should they just like pee in a cup and bring it with?
So when it comes to the blood test, it has to be done within 4 hours of the episode happening. If in the case of the urines, it still should be within hours, but often you collect for 24 hours afterwards. But they are around in the urine for longer. But I wouldn't wait till the next day. It's not gonna not. That would be too long.
So Josh, you mentioned that ideally you would get a 24-hour urine collection and not just one sample, correct?
Yeah, and that just has to do with the way that your body metabolizes things. Different people may have had more or less water intake at that point in time. The accuracy is the highest when you do a 24-hour urine collection, but what's called a spot urine collection, it could be correct. It's just not as well validated as when you do the 24-hour urine collection. And the other thing is that there are 3 different metabolites tests to be done, and usually we do all 3 of them because it's in combination that they become the most accurate than just doing one. You only have to collect once. When you send it for the test, they can then send the 3 different tests. None of those tests are histamine. So we don't look in the blood for histamine. We don't look in the urine for histamine. It's not as accurate. It's not diagnostic. Most people metabolize histamine very, very quickly. So you won't see it, even if something really bad has happened. And if the histamine is higher, there may be another reason why it is. It's not diagnostic of a mast cell problem.
And then Courtney, do you think we need to explain what metabolites means? Okay.
I had mentioned before, it's your body breaks down what the mast cell makes. And that's the thing that we can measure accurately. Whereas tryptase, when you measure that, that is actually what the mast cell is making. It's not being broken down. It's being made by the mast cell.
So in the
Okay.
blood, we're measuring the tryptase, and in the urine, we're measuring the metabolites, which is the breakdown products of
Correct.
the things that the
Yep.
mast cell makes.
Yep.
So just wanted to clarify that for all the patients out there and maybe even physicians.
So I have a question, and this is just a curious thing. So imagine it's like I can't get to my doctor in 4 hours of my reaction to get my blood drawn. Is there ever a case where if I know kind of what triggers that, I can sit in the office, do it, and then you can grab my blood?
So that is something that sometimes people do. We call it a challenge. Usually, if I'm allergic to blank, am I really allergic? We'll do the challenge in the office, and if there is a reaction, we would draw blood. But the truth is that I don't think we usually would do that for someone who's worried that maybe they have a mast cell disorder. I think there might be some rare cases where it's really not been clear despite trying some other things to try. That is precisely though why it's difficult. Why using the blood test is just difficult, because people can't get to it. And so actually what I tend to try to do is to send patients home with the urine collection kit. So they have it, and then they're empowered to go ahead and get it done whenever an episode happens, and then they don't have to worry about getting the blood test done. I would love for this to become something that's easy for any doctor to just set you up for, and then if there's then when the result comes back, if it happens to be abnormal, then you can be referred. It's actually easier to already have that answer than it is to go, and say, can you figure it out? And it's hard to figure it out without, having one of those tests give us an idea beforehand.
So we've talked about the fluids that would be collected. What about like the skin biopsies? Because I know I've read a lot about skin biopsies and mast cell
Yeah.
diseases. How does that look, and when would you decide to biopsy skin?
So the only time I would biopsy skin is if I saw a rash that I think might look like the rash that can happen in mastocytosis. That rash is called urticaria pigmentosa. The more common way to diagnose it than doing the biopsy, believe it or not, is to simply scratch above that rash, which in adults often looks like freckles. In kids, it can look like all different kinds of things. The point is, it doesn't come and go. It stays. It can be sort of all over the body, or in kids, it can be in one place. That's called a mastocytoma. But those freckles or the different ways that rash can look, if you scratch right above it, it makes like a hive. And then the hive goes away, and then you still have the rash that's there. And if you scratch somewhere else on the body, you don't get a hive. Right? There are some people you can scratch anywhere, you get a hive. That's not urticaria pigmentosa, and that's not something you need to biopsy. It would just be if there was a rash that looked something like it, and it hives up, that can be enough. There definitely are people who never get a biopsy because it's completely clear that it's urticaria pigmentosa. You don't need to do the biopsy because of the other diagnostic stuff that's been done. But in cases where it's not clear, you would just biopsy that spot that rashes up, that hives up, and it looks like it could be urticaria pigmentosa. You would just biopsy that, and you would look for abnormal looking mast cells. It's not a number of mast cells that matters at all. It's that they're abnormal looking in the pathology. And the same is true for in the gut. So very often I get asked, "Oh, I'm getting an endoscopy. Should we do special stains to count the number of mast cells?" And the answer is we don't have normals for you can have tons of mast cells as long as they don't look abnormal. They probably don't have anything much to do with a mast cell disorder, because mast cells can accompany all sorts of things happening in the gut normally. And then also with other kinds of inflammation, mast cells can come along. And so that doesn't mean just because you have more mast cells in your gut that there's a problem. It would be as if they are clumping up and having huge numbers, and looking atypical under the microscope, that then you would want to do other things to say, ooh, those are atypical mast cells. That's what you need to worry about. And that doesn't take a special anything. And actually, in the end, those are the only lab tests that really have significant value. The serum tryptase and the urine metabolites, not urine histamine, not serum histamine, not serum anything else. All the biomarkers that people have tried and hoped that they would help us, be able to differentiate, they just haven't panned out. Unfortunately, we wish we had better. The urines even still need more panning out in the general population as opposed to just people with mastocytosis, to be clear. Those are really the only tests. I mean, and doing your blood count, because again, some folks with mastocytosis, their blood count can go down. Things are getting much more severe. You would be worked up no matter what if your blood count started dropping for all sorts of different stuff. But specifically for a mast cell disorder, those are the only things that we're going to be looking for to find a mast cell disorder, right? If you find something in those, then there are other tests that we do to see, could it have been an allergy or could it have been, something else.